It's Breakfast Daily on Citi TV, and it's a Tuesday, so you know what that means. Your favorite doctor, Dr. Kelvin Owusu, is here. Of course, he's the medical director of Anatomical Diagnostics, and today we're talking about urinary tract infections. If you have any questions for him, let us know with the hashtag Breakfast Daily, and our WhatsApp line is 0550585832. If you're outside Ghana, the country code is +233. Good morning, Doc.
Good morning, Dziffa.
How are you?
I'm very well, and you?
I'm good. Before we even get into the urinary tract topic, a friend of ours, Doji, says his wife might be pregnant. She sleeps a lot. Is that a symptom of pregnancy?
Well, it could be. I mean, pregnancy is a whole new experience for every woman. So some people respond to it by sleeping quite a lot. Others respond by not sleeping enough. You know, so especially the initial days are quite confusing for the system, the woman's body. So yes, it can present with sleeping.
Doji could be getting a corona baby on the way. Anyway, urinary tract infection.
Yes.
What is it?
Well, as the name suggests, it's an infection of the urinary system or the urinary tract. And the urinary system extends from the kidneys through the ureters and then goes into the bladder, then to the urethra, and then out into the whatever, the open, the WC, wherever. So it's a system of organs and tubes that form the urinary system. Okay. And infection along this tract is a UTI, a urinary tract infection.
Okay. What are some of the causes?
Well, the commonest causes are bacterial infections. Okay. So the bacteria, and usually bacteria comes from outside, enters the system and can affect different aspects. So it can affect only the kidneys, only the bladder, only the ureter, only the urethra, or all over. Now, because it's coming from outside, usually it will start in the urethra because that's the termination point, and then it's going to the bladder. It will ascend into the urethra and then into the kidneys.
So those are like extreme stages.
Yes. By the time it gets into the kidneys, you know that it's quite a severe infection. Of course, you can have a situation where it can happen as a part of a generalized infection, something we call sepsis. Okay. So the original infection may be elsewhere, let's say in the lungs or somewhere else, and then it spreads into the blood, and then it seeds or it settles in the kidneys or bladder or wherever. So it can become part of a generalized infection in the whole human being. That's what we call sepsis.
Wow.
But most of the time, it's something from outside that goes in, establishes itself, and then you have the symptoms.
And I read that it's more common in women.
Yes, it is. Anatomically, women are more likely to get a UTI than men. I think there are some pictures they'll show later where you see that the urethra of a woman is pretty short. Okay. So the distance that the bacteria has to travel from the outside into the bladder is very, very, very short. Whereas the male urethra is quite long. The female urethra is about 2 cm to 4 cm. Okay. Then the male version is about 13, 14 cm. So that's very, very long. Okay. So the bacteria, most of the time, is unable to travel that far into the bladder for the man. But for the woman, it's able to. And also, anatomically again, because the urethra of a woman is quite, this is a bit graphic, but...
And we have the picture, so if we have it, we can show it so that we follow you along as you're describing it. We'll show it soon, but go ahead.
So I was saying that the urethra of a woman is pretty close to the anus. Yeah. So the perineum, we call that whole area the perineum. Okay. So you have the urethra, you have the vagina, and then you have the anus. Yes. So personal hygiene plays a role. Okay. And I'm sure all women have been taught that they should clean from the is it front?
Back. You don't clean from the back to the front.
But in the heat of the moment, how do you know which way you clean?
Heat of which moment?
Well, maybe you had a diarrhea, you were just cleaning things.
Oh, no. the back is where your anus is. You can't clean from the back to the front.
No, you are saying so. I've seen things.
Okay, so some people actually clean from the back to the front.
Some people do all sorts of things.
Okay, so we don't want our viewers to do that.
Let's take, for instance, a kid. Okay. A girl, a little girl. She goes to do number 2. Goes to poo-poo. How do you know what she's doing in there? True. So she's doing everything. Cleaning front, back, front, whichever way.
As long as it's clean,
exactly.
She's fine.
So what you end up, what you tend they do then is that they will take bacteria, and the anus has a lot of bacteria. In fact, the GI, the digestive system, there's a lot of bacteria in the digestive system. Okay, so looking at this one, you can see obviously that the urethra of the female is very, very short. Yeah. So the bacteria doesn't have to travel far to go and establish an infection in the bladder. But if you compare that to the male, it's really, really long. Yeah. So that by the time the bacteria travels from the tip of the penis all the way to the bladder, I mean, the body might have been able to deal with it. So that's why anatomically it's more likely for a female to have a UTI than a male.
Viewer Paula wants to know the distance between the urethra and the penis has nothing to do with the size of the penis itself. Right?
Well, of course. I mean, it does play a role. The size, in this case, the length of the penis.
Okay.
It will definitely play a role. Okay. You know, and so if the penis is longer, then I mean the urethra will be longer. I mean, if the penis is shorter, then the urethra will be shorter. But I mean, the thing is, the difference in the length of penis is not that much.
Okay.
You know, it's not as if one penis is 2 cm and the other penis is 20. It's not that much.
Okay.
You know,
you're the doctor.
But yes, generally speaking, the female it's easier for a female to have a UTI because anatomically the urethra is short, and also because the anus is very close to the urethra. So you can easily carry infection from the anus into the urethra and then infect yourself.
How does it travel all the way to the kidney?
So the connection between the kidney and the bladder is the ureter.
Okay.
Remember that when it comes to urine production, the urine is produced by the kidney. It travels down through the ureter into the bladder where it's stored. And when you have the volume is enough, then you have the urge. You go and urinate through the urethra.
Okay.
When it comes to the infection, it comes the reverse. It's the bacteria travels from the outside through the urethra into the bladder, establishes an infection in the bladder. If it's not treated properly, it keeps climbing upwards. So then it goes into the ureter and then it finally settles in the kidneys. And our kidneys are very delicate. I mean, I'm sure we all know kidneys are very delicate. And so you don't want an infection to go into the kidney. So as much as possible, it needs to be treated properly so that it doesn't ascend into the kidneys to cause a pyelonephritis or pyelonephritis or any of those things.
Wow. We're going to talk about prevention, but what are some of the signs and symptoms of urinary tract infection?
So let me just say that the sign and symptom depend on which part of the system is affected.
Okay.
But generally, because the other parts come in much later, the commonest signs you notice will be the signs around the urethra and the bladder, which would be that you'd have a feeling to go and urinate, and it comes more frequently. It's called urgency. Okay. You know, and it's associated with pain on urinating. So when you feel like urinating, when you immediately start urinating, you get some pain or burning.
Wow.
You know, that's described as dysuria, painful urination. You know, you could have frequent urination as well because the bladder is irritated. It's not able to expand to its full capacity because there's an infection, there's an irritation. So the moment urine goes into the bladder, you feel like urinating. So that's frequent urination as well. So you have the urgency, the frequency, and the dysuria. These are medical terms, you know, but they are the classic symptoms for a UTI.
Which one's a dysuria? The
dysuria is the pain or burning when you start urinating or during the urination. Okay. Sometimes you may see some blood.
Ooh.
And depending on the color of the blood, it can give the doctors an indication of where the infection is. Usually, if you have blood that actually looks like blood, red blood, it means that the infection is closer to the outside. Okay. So that we are looking at the bladder or the urethra. If the blood is altered, in other words, the color of the blood is not. You may not even be aware that it's blood until you run a test. It means that the blood is coming from higher up.
Ooh.
And sometimes you may not see blood at all, but when you do the test, there's blood in there. That tells you that the problem is probably in the kidneys. You know, so all of these are signs and symptoms that you could have a UTI.
At what point do you say, okay, let me go see a doctor immediately? Because some of us pee a lot. That might not be a urinary tract infection.
It might not. So, you see, if you pee a lot, if you drink lots of water, you pee a lot. So when somebody comes to me and complains that I'm peeing a lot, the first question I ask is, how much water are you drinking? And secondly, if you pee a lot during the night, it could be an indication of something else, diabetes or something like that. Because in the night, most people do not wake up to go and drink water. So if you are peeing so much in the night that you have to wake up and go and drink water, and it's not a conscious decision. When I say conscious decision, I mean you haven't decided like you wake up and go and drink water. But because of your peeing, you are actually thirsty, so you get up and go and drink water. It could be a sign of diabetes, you know. But that's not a UTI. UTI must come with the pain or the burning. It must come with the urgency. The urgency is in the sense that you just got up and went to wee. Then you come and sit down, and within a few minutes, you have to go and wee again. And it's associated with the pain. So that makes it, just to clarify, and when you do go and stand there, there's not much pee. That is the urgency. It's because the bladder is irritated, so it's not able to expand to accumulate all the urine that you would have accumulated normally.
Wow.
So that's what makes it a UTI.
Does it change the color of the urine at all?
Yes. The urine mostly will be cloudy.
Okay.
Instead of it either being clear yellow or colorless, you'd have cloudy urine. And it might have an offensive smell. So those are some of the other signs that to show that you actually have a UTI.
How do we prevent contracting a UTI?
So for the females, because they tend to have it more often, to prevent a UTI, personal hygiene is very important. So as much as possible, clean from the front, back, all the time, regardless of whatever moment you are in.
Front, back, guys,
front, back.
At all times.
Very, very important.
We're not talking about the club called front, back. Front, back.
Yes, front, back is very, very important because you don't want to introduce bacteria from the anal region to the urethra. You don't want that at all. Okay. So front, back. Personal hygiene is important because sometimes you can't really avoid it in the sense that as you sit, as you get up, your underwear may be shifting. So personal hygiene is very important. It's not healthy to wear the same underwear for, I don't know, God knows how many hours. It's important.
Change it every day.
Exactly. At
least. Maybe twice a day is advisable.
Exactly.
Or is it right?
Yes.
One in the morning, one before you go to sleep.
Exactly.
Assuming you take a shower twice a day. Please continue.
Very important. Then there's also something called, should I say, honeymoon cystitis. And this is something that women would get when they get married, assuming they are not sexually active already.
So if you're a virgin.
Medically virgin.
Okay. If you've never had.
You haven't had sex in a while.
Okay. So it doesn't have to be your first time.
Exactly. Then you get married, you go on honeymoon. Obviously, there's going to be a lot of sex during honeymoon. And because of that, there's irritation of the bladder. So there tends to be some pain on urination. It might not be a UTI. But then it could be, it's the bladder being irritated by a lot of activity in that area.
So should they slow down, or it's okay? It's advisable medically?
You've waited this long. What's slowing down again? Enjoy yourself. After honeymoon doesn't last forever.
Okay, we're just making sure she's protected.
I bring this in because it could lead to a UTI. Because your bladder is irritated. Which means, when I say irritated, it means that there's some kind of injury. Okay. It's kind of like you bump your hand against the wall. You are not going to die, but then there's pain there. If you bump that same hand again, the injury would be more severe than if you had been bumped the very first time. Okay. So if you had this cystitis, and then a bacteria enters the bladder at that time, the bladder is weakened. And so you are more likely to get an established infection at that point than if you had not had that cystitis in the first place.
So at that point, should you have the conversation with your partner that this is what I'm feeling, maybe we should take a break?
Yes, it's very important. But it's also known that if after you've had sex or had sexual activity, you need to pee. Yes, so that you can sort of flush the system. So it's good to pee after you've had sexual encounter.
For both men and women?
But in this case, typically women.
Okay.
Because they are the ones who are more likely to get it. You see,
does this mean you should drink water before the act?
Well, whether before or after is not important.
But where is the pee going to come from?
There will be pee.
Okay.
So if there's drink water and then try and pee as soon as possible.
Okay.
But most of the time, because the act itself, like I said, it causes irritation to the bladder, you most likely feel like peeing. So don't ignore the urge to pee after you've had a sexual activity. Okay. It's important that you go and pee and then flush the system. Okay. And if possible, drink water and flush some more. Because it's important. The activity causes trauma to the bladder. It's not trauma that will kill you, but that trauma could make the bladder more susceptible to an infection.
Wow.
And then
please continue.
You seem like well, so that's the thing. So that and also if you notice any changes, any pain or burning during urinating or frequency, it's important that you report to the hospital early and have proper screening or testing done. Because if you ignore it, remember that it can ascend into the higher places, the kidneys especially. You don't want that to happen at all. What
will happen when it gets to that point? What's the worst that could happen?
Worst case scenario, the kidney will shut down. Yes. And you need dialysis, and dialysis is a whole different ballgame. But that's the worst case scenario. That's assuming you did nothing about it and it gets there. You could actually die from a kidney infection. Yes, you could die from a kidney infection. It's a big deal.
So how do we treat UTI?
So UTI, most of the time, UTIs are caused by bacteria. And so the treatment is usually antibiotics. Okay. But I see the difficulty for us is that because people think that all antibiotics are antibiotics, they just keep buying any kind of antibiotic, and that presents a problem for us. You see, because now we are having resistant strains of bacteria. Because anybody can just walk into a pharmacy and describe what they are feeling, and they give them just anything. It's not good enough. It's not okay. We need to take the sample of the urine and test it and see what particular bacteria is causing your problem, and then give you the right antibiotic. Because every drug, every antibiotic has side effects. So it's not good enough to take this one, it doesn't work, take that one, it doesn't work. No, the tests have to be done. If we do the testing and we see that it's this bacteria that's causing your problem and this antibiotic will work for it, we give you that treatment and that's it. Okay. And interestingly, sometimes the antibiotic that of choice is actually a very cheap antibiotic.
And it might not work.
No, I'm saying that if you did the testing, you'd find that the antibiotic of choice for that particular thing is some cheap antibiotic.
Okay.
But then because you've now going to spend money on other antibiotics, you don't even have money to now buy the cheap one. And then the ascending infection now begins, and it causes more damage. And so as much as possible, when you notice some of these symptoms, report to hospital early, and then the appropriate testing and appropriate treatment will be started for you.
So we should place premium on testing so we know exactly what is wrong with us.
Very important. Okay. Because it's not just one bacteria that causes UTI. There are different bacteria. All of them respond differently to different antibiotics. Okay. So it's not like one antibiotic beats all infections. No, it doesn't work like that. Okay. So we need to do the testing to find the right antibiotic for your particular infection.
Okay, now we've talked about women extensively. What about men?
Well, men should, because we don't get the UTIs too often, it doesn't mean that we don't get them at all. We still get them. Okay. But when it comes to prevention, there's really not much different you're going to do. However, before I forget, when it comes to the women, every time you change sexual partners, your risk of UTI increases.
How?
Because again, everybody has their own, we call it normal flora. Okay. Everybody has their own bacteria that they have an arrangement, they have an agreement with. So
you and your partner's bacteria would eventually agree to each other?
Exactly. Okay. So now you are used to your partner's bacteria. Okay. So when you change partners, a new set of bacteria is introduced. And so your body now needs to, readjust to it. So people with multiple sexual partners are at risk of getting UTIs. And some of the STIs can also present as UTIs. Wow. Something like gonorrhea can present as a UTI. Herpes can even present as a UTI.
Wow.
So UTIs, if somebody keeps getting UTIs frequently, we actually screen for the STIs as well, the sexually transmitted infections.
So it could be a sexually transmitted infection. There's a question here. So this comes from Ruby Amanda. She says, so on average, how many times is it okay to wake up and pee at night?
So this question is really dependent on how you have trained your body. Okay. I know people who consciously wake up to urinate like twice a day. Twice in the night.
In the night. Some people go 4 or 5 times. Is that normal?
So it depends on how you train yourself. If you wake up to go and urinate every time and it's a lot of urine, usually clear urine, the colorless urine. So the volume is a lot, the frequency of urinating in the night is a lot, and it's causing you to become thirsty to go and now get water to drink, then you know that there might be a challenge. Very, very important. So if you are if you wake up once or twice a night, it's not really a big deal. Okay. But if you're waking up 3, 4, 5 times, and each time you go, it's a lot of urine, then there's a challenge right there, and you need to go and have a screening for diabetes done.
Wow. Thank you so much, Dr. Kelvin Owusu. Where do we follow you on social media?
Well, you can follow me on Kelvin Owusu MD on all the social media channels. I've learned my lesson now.
Why? Salah Martin Wayne from Sierra Leone says, I am enjoying the show. Thanks, doctor, for the advice. Thank you so much, Dr. Kelvin, aka Nase Puku. Hi there. We hope you enjoyed the show.
Make sure to subscribe, like, comment, and share with your friends.
This is Breakfast Daily on Citi TV.
Join the Breakfast Daily team Monday through Fridays from 7:30 a.m. to 10. Join us for breakfast daily, only on Citi TV.